and welcome to Medical Dialogues. I'm Anshika Mishra, here's what I bring to you from the world of medicine. Watching others visibly dislike vegetables might make onlookers dislike them too. Humans learn which behaviors pay off and which don't from watching others. Based on this, we may draw conclusion about how to act or eat. In the case of the latter, people may use each other as guides to determine what and how much to eat. This is called social modeling and is one of the most powerful social influences on eating behavior. In a new study, researchers in the UK investigated whether observing others' facial expressions while eating raw broccoli influenced young women's disliking and desire to eat raw broccoli. We show that watching others eating a raw vegetable with a negative facial expression reduces adult women's liking of that vegetable, but not their desire to eat it, said Dr. Katie Edwards, a researcher at the Aston University School of Psychology and lead author of the study published in Frontiers in Psychology. This highlights the power of observing food dislikes on adult eating behavior.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Nationwide studies suggest link between medical cannabis for chronic pain and abnormal heart rhythm. People taking medical cannabis for chronic pain have a slightly increased risk of arrhythmia, according to research published in the European Heart Journal on Thursday. Arrhythmia is when the heart beats too slowly, too quickly, or irregularly. It includes conditions like atrial fibrillation. Recreational use of cannabis has been linked to cardiovascular disease, but there has been very little research on the side effect of medical cannabis. Researchers say the new study is important as a growing number of countries now permit medical cannabis as a treatment for chronic pain. The study was led by Dr. Anders Holt from Copenhagen University Hospital, Herlev and Gentofte in Denmark. It included data on 5,391 Danish patients who had been prescribed cannabis for chronic pain. This included people with pain in their muscle, joint or bones, people with cancer and those suffering with nerve pain. Researchers compared this group with 26,941 patients who also had chronic pain but were not receiving cannabis as treatment. Perinatal depression linked to an increased risk of death. Women who suffer depression during or after pregnancy have a higher risk of death by both natural and unnatural causes. A new study of childbirth in Sweden published in the BMJ reports. The increased risk peaks in the month after diagnosis but remains elevated for as long as 18 years afterwards. Women who develop perinatal depression, which is to say depression during pregnancy or shortly after childbirth, are generally twice as likely to die of natural or, as in most cases, unnatural causes. These are the results of a large cohort study that used data from the Swedish Medical Birth Register, which effectively contains all births in Sweden since 1973. Basing their study on women who had live birth between 2001 and 2018, the researchers compared over 86,500 women diagnosed with perinatal depression during pregnancy or up to 1 year after childbirth, with over 865,500 matched controls of the same age who had given birth the same year. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.